God has got to change. I grew up in a community where every health-related issue was attributed to the anger of the gods. Even though that notion has changed, access to healthcare is very limited, and about half of the people in my village still live by that superstition. When my father couldn't get access to treatment when he suffered at 1 midnight and died as a result of that, I vowed to be the change my community needed. My name is Matthias Ajay, an international student from Ghana, majoring in public health and entrepreneurship. In 2021, a report released by the Ghana Statistical Service showed that only 47% of households in rural areas have access to healthcare facilities within a 5-kilometer radius, as compared to the 95% in urban areas. This is so disturbing. Another study published in the Journal of Global Health in 2020 found that there is a shortage of health workers in Ghana, particularly in rural areas. The study reported that in some areas, the doctor-to-patient ratio was as low as 1:10,000. Could you believe this? It is so crucial that we work together to improve the healthcare access and outcome for all, and I am committed to be part of this change.
I'm impressed. Go here attendance in the by a cry. It's in the Panunia, Apodisha, Mapaman Nipedia. And I'm saying that we can Scassembly, go here, Piny, Tamo, Bukra, area or the Bacopra, problem. Internet, the Median day. Wait, Mac, I say, Abua, now way pounds. My idea. They are preparing this for us. Say, buying him now, walk hand one. Yes, another program. So, buy him now, what can you get in 10 now?
My name's Leslie Haxby McNeil. I'm in the Office of Student Wellness. I advise Hawks Peer Health Educators, and I've worked with Matthias for the past 2.5 years. He is simply an amazing man. And if you get to know him and hear his story, he is all the more inspirational and amazing from where I sit. In Hawks, he has served as a manager and then was promoted to a vice president of operations. And that's because he is organized, intelligent, intentional, and he brings a passion for health and health care that I don't see very often in a college student. He truly is an inspiration to the people who work with him. He has shared his story and his passion for bringing healthcare to marginalized communities. And I find it particularly inspirational that he has worked towards his goals with a lot of thought and care, staying present in the moment, all the while thinking about what his overall goal is. He has shared a previous video that he did, and it was one of those moments where I felt like I truly knew him, and I saw with fresh eyes what is needed in the communities he's seeking to serve.
I'm a professor of psychology in the Department of Psychology at Miami University, and I'm here to talk about working with Matthias Ajay on his health and medicine project in Ghana. So it may be useful to know that I was a Peace Corps volunteer in Ghana from 1990 until 1992, where I served as a secondary school teacher in Asamine in the Ashanti region of Ghana, and had a wonderful experience there. And I think I first met Matthias 2 years ago as a global health student, and have been working closely with Matthias for the last several months on the project that was launched 2 weeks ago in Ghana.
Participating in this program has been an incredible eye-opening experience. During my nursing studies and clinical training, I never had the chance to work with patients from rural villages like this. Through this program, I have gained valuable experience and insight, which will stay with me throughout my career. I want to say the application process and interview was a challenging one, but I am grateful for the opportunity to be selected among a number of applicants. I also want to extend my gratitude to Matthias for creating such an amazing opportunity and providing me with an rewarding experience. I am excited to see what the future holds, and I hope to study and grow in my career.
I was impressed with Matthias's uptake of learning in the area of best practice process, the use of the getting to outcomes model as a way of organizing his approach to addressing the health needs of people in rural Ghana, and was very impressed with his ability to understand and make use of the 10-step process.
To effectively address disparities in healthcare, we must first understand the root causes. It is not just a matter of one single factor, but rather the result of policy decisions made by society as a whole, from environmental factors to access to care, health education, and insurance. There are many complex issues that contribute to this problem. To truly solve these issues, we cannot rely solely on medical solutions. We need systemic change that involves all sectors of society. Every individual has a role to play in creating a more equitable and just healthcare system. By working together and addressing these underlying issues, we can make progress towards a healthier and more equitable future for all. To address health disparities in my community, I founded the Hope and Medicine Project. Hope and Medicine Project is a community-driven initiative that mobilizes and empowers local residents to take charge of their own health through education, prevention, and treatment options. We believe that by working together and leveraging community resources, we can make a significant impact on the health and well-being of our own people. I am excited about the potential impact of the project and committed to making a difference in the life of those we serve. Hope and Medicine Project is focused on creating a healthier and more vibrant community for everyone.
So I've had the opportunity to know Matthias since our high school days. And honestly speaking, I really admire Matthias based on his leadership skills, his problem solving skills, and his compassion for others. Matthias has been a very close friend of mine since our high school days, and his love for other people is very, very impressive. Matthias is someone who has developed passion for the sick people, most especially those who are in the deprived areas. Matthias gave me this initiative earlier last year that he has a project that he intends doing. So I also gave him my mind and I was in support of the entire project. So the program nearly expired because of the ups and downs that we were currently facing. But he told me that, Joe, this program, we must do it for the betterment of those people living in deprived areas, most especially those in rural areas who are having difficult access to healthcare. I'm proud to know Matthias and inspired by his dedication towards making a positive impact to the health sector, most especially in those living in deprived areas.
The success of this initiative, both now and in the future, depends greatly on the support of licensed health professionals, community leaders, and other stakeholders just like you. This program will provide a valuable opportunity for her students to learn about serving underrepresented communities and making a positive impact on people's lives. By working together and building a strong partnership, we can create sustainable and impactful initiatives that will benefit communities for years to come. I am excited to see the positive change that we can achieve through this program and the collective effort of all those involved. Our program is focused on educating people about the importance of healthy lifestyle choices, including proper nutrition, exercise, and hygiene. We are also working to reduce risky behaviors like tobacco and alcohol use. In addition to this educational effort, we are conducting health screening to identify any underlying conditions and providing necessary medication. For any condition that fall outside our scope of care, we will refer individuals to the nearest regional hospital. Our goal is to empower individuals to take control of their health and well-being and support them in achieving a healthier, happier life.
And he is always calm, gentle, inclusive, and really has been a joy to work with. As he looks forward to the other projects that he has and what he hopes to accomplish, I'm sure that he will bring all of these qualities, as well as his experience, his knowledge, his skills, to the betterment of all of these communities.
Nti no ma bebre ni yen krum a nkola nso ya doso nkura guo ha nyina doso bebre ka se report ni a bebre kwa nti te mo ba boy ya doctor no wo ba ba hwe ase na wo ma no ya doctor a han ke pepa na school kura no anye pe toilet kura bi ni kura nti ya nka wo ma no ho anso so ya ka ho nti se wo ba bo mo dia ba ba hwe ase na ya da wo ma se.
A strong nation requires a healthy population. To achieve this, we must ensure that everyone has access to high-quality healthcare and the resources they need in order to stay well. We cannot allow disparities in healthcare to persist. We must do whatever it takes to address them. If we do not take action, who will? Let us work together to build a healthier and a more equitable society